Injury can strike at any age, it doesn't just happen to old people. Being of ages between 14 and 16, your body is going through many physical changes. This can increase the risk of injury. Being injured is no fun. It's highly likely throughout your career you will unfortunately experience injury. But how would you feel if we could aid recovery? Today we would like to introduce you to Imagery, an easy way to help you. You can use your mind to create a lifelike experience. Using all 5 senses, you can see the pitch, smell the air, touch the ball, hear the crowd and taste the oranges at half time. Imagery can be useful in recovery for many different reasons. Some of these are skill improvement, motivation, success, decreasing negative thoughts, and injury recovery. So what does this actually mean? You can use imagery for skill improvement, as you can rehearse your skills so that when it comes to doing them in a game situation, you can perform them more naturally. You can motivate yourself by imagining yourself scoring, tackling an opponent, show yourself that you can do it. You can use imagery for success. You can see yourself lift the trophy, celebrating with your friends after. You can use imagery to decrease negative thoughts, as you can imagine yourself writing those thoughts down. Screw up the paper you wrote them on and throw it in the bin, getting rid of those thoughts. Today's podcast will be directed towards recovering from injury. You can imagine yourself getting rid of the cast from your broken arm, getting rid of the bandage from your swollen ankle. Just imagine the pain disappearing while healing and rebuilding the area. Listen on to find out how to effectively use this method in injury.
The different phases of injury rehab require different imagery techniques. The phases are the early phase, the mid phase, and lastly, returning to training.
The early phase uses relaxing imagery to help you control your pain and swelling. You may experience feelings of sadness and frustration as a result of your injury, but this is only normal. Timing your imagery is important to help stop those feelings. You should feel the current state of your injury and imagine the pain leaving your body. Remember that training session when you successfully performed that skill, when you dribbled past the defender, when you scored the winning goal. Hold on to these positive feelings to remind you of what you can do.
If you experience slow progress with your rehabilitation, you may experience anxiety. Here it is vital to continue using imagery to remind you of your final goal and to remain positive. The mid-phase of rehabilitation should be focused towards visualising the light at the end of the tunnel, increasing your confidence to return to previous performance levels. This should motivate you to adhere to the rehabilitation programme given to you by your doctor or physio. You can continue to use imagery to rehearse your skills and manage your pain, and you should become more accustomed to using imagery now that you can use it more frequently on your own as well as the rehabilitation exercises. This will keep you in touch with the technical side of your skill performance. For example, you should remember how you take a free kick. You pull your leg back, keeping your eyes on the ball. Your knees are bent as you strike the ball. You arch your back and your leg follows through. If you experience slow progress with your rehabilitation, you may experience anxiety. Here it is vital to continue using imagery to remind you of your final goal and to remain positive. In the run-up to your return to training and competition, you may experience the fear of re-injury as you begin to re-immerse yourself into your sport. It is important that you use positive cues from your past performances. For example, imagining your response as a referee blows the whistle at kickoff, to provide you with the confidence that this will not happen again. This will bring closure to the injury. It is important to rehearse skills and strategies at the level you did before you were injured. At this point, imagery won't be used any longer for pain management. In order for you to use effective imagery during sport and to ensure you image the desired outcome, we can use the PETLEP model. PETLEP is an acronym with different elements of imagery you should consider: physical, environment, task, timing, learning, emotion, and perspective. If you were to prepare taking a penalty kick in the quarterfinals of the League Cup, applying these principles will enhance the performance outcome.
P is for physical. You imagine yourself in your kit, wearing your football boots, wearing your shin pads.
E is for emotion. Imagine how you are feeling, the determination to score so that it can push you through to the next round. Do this frequently and it will make you start to associate the feelings with playing and success. The first T is for task. You need to concentrate on the corner of the goal that you're aiming for. Approach the situation as you normally would. Do not look at the goalkeeper and focus solely upon the ball. T is for time. Imagine your timing as you approach the ball, how many steps you're going to take, how you're going to execute the shot. Imagine the ball in real time as it passes the keeper. The L in PETLEP is for learning. You can use imagery to learn about a situation. For example, are you predictable? Does your body shape give away where you're going to shoot? Using imagery, you can teach yourself to change your technique. The second E is for environment. You should focus your attention to imagine standing at the penalty spot. Make it as accurate as possible to the actual situation you would encounter. Imagine the noises of the crowd as you approach the ball. You can use all 5 senses like we mentioned earlier. The second P is for perspective. It's up to you how you'd like to view the situation. You could be looking at the ball through your own eyes, or looking at yourself taking the penalty from above. When you do this, it gives you a different perspective of it. This is Ben. Ben is an injured athlete trying to overcome the injury he has. To help Ben, we have prepared him an imagery script that he can recite when he needs to. Here is the example. Focus your attention to your injured ankle. Detect the way it feels and looks. Concentrate on the swelling and see it getting smaller and smaller back to the normal size. As he gets back to normal size, you'll see the bruising disappearing. Your ankle now feels more normal. The fluid has drained out. You feel it leaving your body. When you look at your injured ankle, imagine a haze of blue around the area. It is cooling and icing the pain. Imagine your ligaments and surrounding muscles getting stronger. They all come together in a slow, strong fashion. You feel all of the fibres in your ankles growing and getting tighter. Look at the muscles around your ankle. Try to relax them and allow them to feel loose. Feel your calf being massaged and the knots of stress being kneaded out. Now notice how your ankle feels stronger, together and relaxed. Concentrate on the feeling of strength and you're getting better. Enjoy that feeling.